Thank you, Hala, and thank you everyone for joining us today to learn more about the impact of COVID-19 on healthcare workers in the occupied Palestinian territories. So for this briefing paper, MAP interviewed healthcare workers in occupied Palestinian territories to examine how COVID-19 pandemic has impacted their well-being and mental health. We have conducted interviews with 17 healthcare workers in the occupied Palestinian territories. 7 healthcare workers were located in the West Bank, 6 in Gaza, and 4 in East Jerusalem. This cohort included doctors, nurses, lab technicians, paramedics who were identified for interviews through the Palestinian Ministry of Health and through MAP's local partner organizations. We have asked healthcare workers about sources of distress during pandemic, their workload, particular moments of hardship, what kind of support was available for them, and what kind of support they wished to receive, and their coping mechanisms. Their responses were transcribed and recurring themes and issues were identified. Healthcare workers spoke openly about high rates of poor mental health outcomes, including burnouts, anxiety, depression, distress. Some have described their work experience as a never-ending nightmare or feeling as if they were drowning, or an urgent rush to leave everything behind and just escape and get lost in a forest. One health care worker from Gaza mentioned that operating during the pandemic was much more challenging mentally and physically for him than the past 3 wars on Gaza. It is important to note that these interviews were conducted prior to Israel's large-scale military assault on Gaza in May 2021 and the protests in the West Bank, including East Jerusalem, which have been also met by systematic use of excessive force. Israel's bombardment on Gaza did not only further degraded the capacity of hospitals and clinics and exacerbated the pressures and strains experienced by Palestinian healthcare workers, but have also led to the killing of 2 senior doctors and 1 psychologist in Gaza. Dr. Mouain Al-Alloul, Gaza's top neurologist, and Dr. Ayman Al-Allouf, head of internal medicine and COVID-19 response at the Shifa Hospital, and psychologist Raja Abu Auf, along with their family and relatives. So what were the main sources of distress for Palestinian healthcare workers during the outbreak of a global pandemic? One of the main sources was unpreparedness and unreadiness and shortages of essential health care resources, financial and humane. The pandemic arrived to an already fragile healthcare system, undergoing de-development and lacking human, financial, and material resources as a result of decades of occupation, blockade, and fragmentation. This challenge impacted the mental health of healthcare workers and their job performance. Many healthcare workers reported that they had to deal with COVID in an environment of shortages in resources such as medicine, disposables, personal protective equipment, and lack of professional skills to deal with COVID-19 patients. Dr. Ibrahim Zakout can clarify more about this point in the next Q&A session. And moreover, several healthcare workers reported buying personal protective equipment at their own expenses. A paramedic from Gaza told us that he had to buy his own masks and gloves on his own expense. And he was very stressed of getting infected and infecting his family. Healthcare workers acknowledged that the capacities of the fragmented Palestinian health system cannot handle a global pandemic. And one of the healthcare workers in Gaza told us that they were anticipating a catastrophe. Another main source of distress reported by healthcare workers was becoming a source of infection to their colleagues, vulnerable patients, and more importantly, infecting their loved ones. Healthcare workers are in regular contact with patients who are at high risk of becoming a source of transmission of COVID-19. 3/4 of our interviewees expressed a fear of becoming a source of infection and making other people ill. They have reported feeling of guilt for becoming a source of infection. This feeling was intensified when the number of infections and deaths increased, when there was scarcity of adequate personal protective equipments, and when operating in locations where implementing social distancing measures was difficult. The reported feelings of guilt by healthcare workers stems from their sense of responsibility toward their families, community members, patients, and their co-workers. According to Health Cluster, around 5,000 Palestinian health workers have been infected by with COVID-19. Therefore, some healthcare workers isolated themselves from their family members by choice and have refrained from visiting or letting their children to visit their extended family, who they were their main source of support. And this leads us to another source of distress experienced by Palestinian healthcare workers, which is isolation and loneliness. However, not everyone who did feel the need to separate and isolate themselves from their family or felt the burden of being a source of infection could isolate and distance themselves from their families. Due to the reality of how crowded and densely populated Gaza City is, not all healthcare workers were able to implement social distancing measures, whether at work, whether at their working places or at home. Thus, they were left to live with a sense of guilt and responsibility, with no option of protecting their families and community. One paramedic in Gaza described how he lives in house along with his family, daughter, and extended family, with no space or separation. According to the UN OSHA, around 50% of Gaza's population lack a separate room and bathroom for members who test positive. Healthcare workers felt that this pandemic entrenched the isolation they felt and separated them more from their fellow health practitioners in Palestine and abroad. They shared their inability to seek support from Palestinian and international colleagues, as well as not being able to be trained and prepared to deal with the pandemic due to the restrictions on movement. Another source of distress experienced by healthcare workers was social stigma and lack of recognition. Healthcare workers reported experiencing social stigma during the pandemic as a result of communities' perception and being regularly exposed to COVID-19. This perception applied to healthcare workers whether they work directly in COVID-19 with COVID-19 patients or indirectly. Healthcare workers reported frustration to be stigmatized after risking their lives and working in the front line to save other people's lives. Interviewees reported that stigma impacted not only themselves, but also their family members. A lab technician in Hebron told us that his son was also stigmatized when one of his classmates refused to sit next to him in the classroom, claiming that he was infectious due to his father's work in a lab. I invite
Thank you